This conference will now be recorded.
Hello, and welcome to the online Home Health Aide program information session. Thank you for taking time to learn more about this program. In today's information session, we will explain the role of the Home Health Aide, provide an overview of the training program, review the program's eligibility, share the next steps to apply for the training program, and review employment opportunities. Then we'll provide some next steps on how you can apply. What is the Home Health Aide Training Program? The online Home Health Aide Training Program is funded by the New York City Department of Small Business Services. It was developed in partnership with CUNY, Workforce One, and the New York Alliance for Careers in Healthcare, the city's industry partnership. New York City's home care agencies are in critical need of home health aides for immediate employment to manage the increased client needs due to the COVID-19 pandemic. Our healthcare system is working to provide more care in the home, and home health aides are critical to this need. What is a home health aide? Home health aides take care of people where they live. They help people receive services to recover from illness, injury, or disability from the safety of their own homes. Home health aides help clients with many activities like getting dressed, bathing, using the toilet, simple chores around the house, and preparing meals. Under the supervision of nurses or medical staff, home health aides may help with some routine medical tasks, like checking a client's heart rate, blood pressure, breathing, and temperature. Home care services are also provided for people who have chronic conditions, such as diabetes, heart failure, and cancer. The home health aide role is one of the fastest growing occupations in New York City and around the country. Home health aides usually work full-time or part-time. Home health aides may work short 4-hour shifts or longer shifts that may be 12 hours or overnight. Home health aides may also have to travel around New York City to provide care in their clients' homes. And on average, home health aides earn about $28,000 per year. Who likes to work as a home health aide? People who enjoy working as a home health aide have patience, compassion, and care about the well-being of others. They enjoy helping people and do not mind working with different types of people. They can deal with sickness and bodily function, and they may be interested in starting a career in healthcare. What skills and traits are needed to become a home health aide? People who want to become home health aides are typically friendly and caring, service-oriented, attentive to detail, and reliable and punctual. Next, in this section, we will review the program details. The program is structured as an online instructor-led course. Classes will be held 9 a.m. to 5 p.m. Monday through Friday, and the training is approximately 3 weeks long. The full training is about 100 hours worth of content, and 8 hours of the training will be held in person for the supervised practical training, where you'll be able to demonstrate the skills you've learned during the course. During the online training, students can get additional support through live classroom Q&As, the teacher's assistance, and through tutoring. Students will also have access to an educational case manager who will offer support and ensure that students have what they need to successfully complete the training. A little bit more about the online component. During the training, classes will be conducted using Zoom and Google Classroom and other online platforms. Students enrolled in the program will need basic computer literacy, access to stable Wi-Fi and internet connection, and access to a personal computer, tablet, or laptop with a web camera. Now we'll talk about what you will learn during the training. Some of the things that you will learn include how to help clients with nutrition and personal care, how to take vital signs, how to bathe, groom, feed, and dress your clients, and how to work with clients of different cultures and backgrounds, as well as working with clients with different abilities, like physical disabilities, intellectual disabilities, or mental conditions. Next, we'll talk a little bit about the COVID-19 pandemic. During this training program, your instructor will provide important information to keep you and your clients safe and prevent the spread of infection from the coronavirus COVID-19 disease. This training will include an overview of the COVID-19, what it is, what are the symptoms, which populations are at risk, and how it's spread from person to person. Your instructor will also provide information on ways that you can reduce the spread of COVID-19, including hand hygiene, hand washing, using gloves, and other steps to prevent infection, as well as how to appropriately put on and take off your personal protective equipment, including face masks and gloves. What are the eligibility requirements for the Home Health Aide Training Program? Eligible candidates must be at least 18 years of age or older, be a legal New York City resident in our 5 boroughs, legally able to work within the United States, and must meet all federal selective service requirements. Eligible candidates who are working must earn no more than $30,000 per year. In this section, we will review the steps to apply to the training program. In the first step, you'll go online to complete our program application. In step number 2, if you meet all of the program requirements, you can register with the Workforce One Career Center. If you have previously registered with Workforce One or received services in the past, be sure to update your online profile. In step 3, after your program application and registration is reviewed, a member of the Workforce One Career Center system will contact you for a phone screening. Candidates marked as eligible during the phone screening will move on to the employer interview. In step 4, the employer will determine if you are a good fit for the home health aide role. Based on your eligibility and the outcome of the employer interview, will decide if you will be accepted into the training program. It is important to note that employment after the training program completion is still dependent on your ability to pass all other employer requirements. Later in this webinar, we'll discuss those employer requirements. Now let's talk a little bit about employment. As we mentioned, this training program will provide you with all of the skills that you need to achieve New York State certification, and you'll be connected with employer partners through home care agencies that are currently looking to hire home health aides. This training is important to fill the critical need that they have. And employers look for New York State certification when hiring home health aides. Home health aides that complete this training program will be registered with the New York State Home Care Registry. What else do you need to get hired? Home care agencies typically require home health aides to be able to work with limited supervision and are able and willing to work flexible hours, including evenings, weekends, holidays, and perhaps some overnight hours. Home health aides must be able to speak, read, and write in English, and follow written and verbal instructions. This training program will be conducted in English. Home health aides must also be able to bend, crouch, reach, and lift about 50 pounds. You may not be lifting 50 pounds every day on the job, but you may need to help clients with activities like moving from their bed or helping them to use a walker or a wheelchair. To ensure the health and safety of patients, home health aides typically need to complete a physical assessment or have completed a physical assessment within the last 6 to 12 months. Home health aides typically are required to complete a drug screen and criminal history record check as a condition for employment. Home health aides may also need to complete a tuberculosis or PPD test. As well, they may need to also have an up-to-date flu shot before caring for clients in their home. So what are some other jobs that someone can pursue after working as a home health aide? It is important to know that the home health aide role can be the first step to an amazing career in healthcare. After further education, people who work as home health aides can go on to become medical assistants, licensed practical nurses, or ultrasound, radiologic, and MRI technologists. These roles need extra training or further education, but offer increased pay and can help you advance in your career in healthcare. As we mentioned earlier, your instructors will teach you about COVID-19 and the coronavirus disease and how to reduce the spread of the virus. Home care agencies will provide special protective equipment known as PPE to home health aides. If your client may or may not have COVID-19, you will still be provided with equipment to protect yourself on the job. This equipment may include gloves, gowns and aprons, masks and respirators like N95 respirators, goggles, face shields, and hand sanitizers. Now let's talk about the next steps. After watching this information session, if you are interested in the Home Health Aide Training Program, we invite you to complete our online program application. This wraps up our information session for today. Thank you for your time. If this information is of interest to you and excites you about becoming a home health aide, or if there is someone that you know that may be interested, we invite them as well to complete our online program application. For more information about this training program and other training programs offered by the New York City Department of Small Business Services, please visit nyc.gov/accesstraining. Thank you.